According to the World Health Organization, mental health is a state of well-being in which an individual realizes his or her own abilities, can cope with the normal stresses of life, can work productively and fruitfully, and is able to make a contribution to his or her community. However, the myriad of life's challenges have been found to threaten one's well-being, increasing suicidal tendencies. A report by BMC Public Health revealed that an estimated 800,000 people die to suicide annually worldwide. The website calculates this as one person every 40 seconds. There are many reasons why people make the decision to commit suicide, and Dr. Newman Arthur explains the possible contributing factors.
High-risk groups like people in the armed forces, the police, medical professionals, and people in such careers. Because of the stresses and the things they're exposed to all the time, they are likely to commit suicide. So for someone to commit suicide, usually there are multiple factors. One factor may become major and may be the trigger for that suicidal behavior. Usually the factors are on 4 levels: physical, mental, social, and spiritual.
In the last couple of weeks, there have been 3 deaths of policemen who are suspected to have committed suicide. Many feel that the stresses associated with their line of work, the Ghana Police Service should concentrate more on the mental health of their employees. The Director of Public Affairs of the Ghana Police Service, Superintendent Sheila Abaye-Bachman, however, explains that though the job can be stressful, it should not lead to suicide.
Suicide is a result of clinical depression or some kind of mental diagnosis. So just like anybody else who is in society, police officers being human beings can get to that point. And therefore, with these new cases that we are treating, although we are investigating and looking at all possible angles, the discussion as to how to prevent suicide is ongoing in the police service.
Superintendent Abaye-Bachman asserted that all police officers entering the police service are given training to prepare them for what to expect on the job. She also alluded to the fact that there is help available for the police personnel to gain coping methods to stave against possible suicide.
The training prepares you to know where to go for which help and the coping measures to take. So you can speak to your commander, in which case if your commander thinks that a referral must be given, it will be given. Counseling in the service has become more impactful with the prevalence of COVID since last year. But where you think that your stress levels just require talking, we have the Religious Affairs Directorate, which also provides counseling.
Dr. Newman Arthur considers the stigmatization around suicide and is making a clarion call for its decriminalization. He believes that it is necessary to critically look at access and affordability of mental health.
This stigmatization of mental health related issues would help people seek help when they need that kind of help. Then on the national level, we need to decriminalize attempted suicide so that people will seek help. Because if they seek help, they are likely not to commit suicide. Then we also need to increase access to mental health care services, and that is critical. Then finally, we need to be able to increase, make mental health services affordable for everybody so that people can be able to access, proper mental health care services.
According to research by Winglow Family International, nearly 3 in 10 police officers in urban Ghana have reported having had thoughts about taking their lives during the previous 12 months. A suicide activist, Gloria Boatima Andor, further called for a holistic approach to tackling suicide in Ghana.
Sometimes as bosses, we need to relate very well with our staff. Sometimes they all battle with their own problems, and all they need is somebody to ask, how are you doing? How is the family? How is everything? It is a relationship you have with them. That is when they can walk to you and tell you what is going on with them. And then if you can help them, you help them. If you can refer them to a psychologist or a counselor, then you can do that. But if you don't have that relationship, that approach will be very, very difficult.
Nonama Anabempong reporting for GH1 News.